to Holistic Lifestyle Tips, Getting Real About the Woo-Woo. I am Becky Russell, owner of wellness company Hope Essential, and I am a holistic lifestyle educator and an essential oil educator. I love to teach, and I love all things holistic, natural. I truly believe we have to limit the amount of chemicals we put on and in our body in order to have a quality of life as we age. And the oils are an amazing tool for that. And we need to treat from the inside out the entire body, mind, body, and soul, and not just symptoms. And that's what holistic means. So I've been following this holistic wellness path for over 25 years. It served me well. I chose that mainly because I saw traditional medicine was not serving the people I love very well, and I inherited a lot of their genes and was pretty much destined for a lot of the same health concerns if I followed in their path. So I chose a different way, and I just want to share what I've learned along the way. And I don't have all the answers, but I am always looking and trying new things, and I love to learn. So I feel it's my responsibility to share what I've learned along my way. And there is physical wellness, spiritual wellness, and emotional wellness. We have to be well in all three in order to be completely healthy. And I believe in taking a proactive, preventative approach to health versus reactive and treating disease. So if you're about all that, then glad to have you here. And I want to open your mind, hopefully, to some new tools, some new things that maybe you haven't heard about. And tonight, especially, there are two things we're going to talk about that are not maybe as well known as some of the other things. And I hope it's not too woo-woo for you. But the first thing we're going to talk about, this is week 37, believe it or not, and we are going to talk about EFT and EMDR. So I would love to know right now if anyone has heard of these two things. EFT is emotional freedom techniques, which is tapping, and then EMDR is, this is a long one. This is a very, this is one that's fairly new to me as well. EMDR is, oh shoot, I'm sorry, my pages got mixed up. Okay. It is, well, I'm going to have to get, it's a real long name. Shoot. Okay. Hold on. Well, okay. I'll write it down in the comments. Hey, Joan, sorry. I'm a little discombobulated. So, EFT. Anyone heard of tapping? EMDR is about electrical impulses. And, okay. So, this has been a very stressful couple of weeks, and it's going to get even more so in the next coming months, I'm sure. And so these two therapies may be something worth exploring if you are having some anxiety, which almost all of us are, but some have it worse. So EFT tapping, it's called emotional freedom technique, and it's an alternative treatment for physical pain and emotional distress. It's also referred to as tapping or psychological acupressure. So people who do this, they believe that tapping the body can create a balance in your energy system and treat pain. And according to its developer, Gary Craig, a disruption in energy is the cause of all negative emotions and pain. And so it's been used to help with anxiety, PTSD, depression, physical pain, and insomnia. So how does it work? It's similar to acupuncture in that it focuses on meridian points, or the energy hotspots of the body, to restore balance to your body's energy. It's believed that restoring this energy balance can relieve symptoms a negative experience or emotion may have caused. So this is something that you can do yourself. You do not need a professional to help you with this. There are plenty of videos and blogs and so forth that explain it step by step. I don't have time to do that here. What this series is for is to just let you know what's out there, and then you go do your research. I'm not a doctor. I'm not telling you what treatments to choose. And these are tools a lot of times to help in connection with standard therapies. So I just want to let you know what's out there. I like having choices. So there are 5 steps that you do with the EFT. So you first have to identify the issue. So you only focus on one problem at a time. And so once you figure out the issue, you test your initial intensity. And so on a scale from 0 to 10, with 10 being the worst or most difficult, you assess your stress level. And you want to know what your initial intensity is prior to tapping, and then at the end you reassess. So the setup, prior to tapping, you need to establish a phrase that explains what you're trying to address. And it has to focus on 2 main goals. So you have to acknowledge the issue and then accept yourself despite the problem. So a common phrase might be, even though I have this fear of flying, I deeply and completely accept myself. And you can alter the phrase, to fit other things, of course, but it can't involve someone else. So for instance, you can't say, even though my mother is sick, I deeply and completely accept myself. It doesn't work like that. You have to address how you feel. So it would be, even though I'm sad my mother is sick, of course that would be causing you anxiety, I deeply and completely accept myself. So you have to understand that. There's 12 major meridians that mirror each side of the body. I can't obviously go through all these steps for the tapping sequence. But like I said, you can Google that and EFT, and there's all sorts of information that will show you how to go through the series. Now, I have to warn you, you'll feel a little silly because you have a lot of, this going on, and, but if it helps, what's the harm, right? And then, of course, like I said, at the end, you have to test the final intensity to see if that has lowered your stress level. So does it work? There have been studies done, and people, especially with PTSD, have been helped, our veterans especially, and it's greatly reduced their stress. And the other thing is, I personally know someone or several people who use this, and one does it specifically for flying and other issues. And a lot of people do it daily just to keep everything, they have more than one issue, so they have to keep tapping. There's a lot of people suffering with a lot of things out there. So there are you know, like I said, a lot of videos. The videos themselves to me are easier to sort of to watch as you're trying to do it, because it is a little convoluted to me at times. And so you might want to try the video. And so I hope if you have any questions on EFT, comment below. The next one we're going to talk about is EMDR, and I apologize, I've lost my other page. I don't know where it's at that's telling me exactly what the acronym stands for. But it also is used for treating PTSD and depression, anxiety, panic attacks, eating disorders, and addictions. And how does this work? Well, there's 8 different phases to this, and it usually takes about 12 separate sessions. So it's a little more involved, and you do need to have a professional therapist, of course. Phase 1 is history and treatment planning. So you have to identify the potential traumatic memories to treat specifically. And then phase 2 is preparation. Your therapist will help you learn several different ways to cope with the emotional or psychological stress you're experiencing. Deep breathing and mindfulness can be used, and I would hope oils, essential oils too, because they can be very calming and soothing. So you could have a diffuser going with frankincense or balance or adaptive, and those would be very helpful. Phase 3 is the assessment. Your therapist will identify the specific memories that will be targeted and all the associated components, such as the physical sensations that are stimulated when you concentrate on an event for each target memory. This is very intense. So it's not, the EFT is a little less intense is what I'm gathering from this. Phase 4 through 7 is the actual treatment, and they will start using the technique to treat your targeted memories. This is really common for, you know, it doesn't have to be TSD. It can be, you know, a traumatic car accident. It could be, you know, an abusive situation of some sort. So all sorts of things, even, you know, like a chronic illness as a child or something where you just haven't been able to move past it. You're okay now, but you're traumatized, any kind of trauma. So this has to do with the eye movements. So the therapist will simultaneously have you do specific eye movements as she's talking, as she's doing the light therapy. The bilateral stimulation may also include taps or other movements mixed in depending on your case. So they may be using part of the EFT type therapy. After the bilateral stimulation, your therapist will ask you to let your mind go blank and notice the thoughts and feelings you're having spontaneously. After you identify these thoughts, your therapist may have you refocus on that traumatic memory or move on to another. So basically, what I'm remembering from the sheet that I had is that if, as they're doing this eye therapy, the light in the eyes, and then you're tapping your hand or something, it's like you're being distracted as you're reliving a painful memory. And that distraction, that physical distraction, whether it's the light in your eye or the tap in your hand, that is helping you sort of decrease that power of that memory. So I'm not saying it very well, but you can Google it and do your research. So, but it's that distraction that they think is what is helpful. Then they will bring you back to the present before moving on to another traumatic memory. And then over time, the distress over particular thoughts, images, or memories should start to fade. So in this final phase, in phase 8, you're asked to evaluate your progress after your sessions, and then your therapist will talk about that as well. So how effective is this therapy? There's been a lot of studies, and of course our veterans are some of that have benefited the most with the PTSD. They found that their hallucinations, delusions, anxiety, and depression symptoms were significantly improved after treatment. So, and the study found that symptoms were not exacerbated during treatment. So that's very important as well. In regard to depression, there was also great promise in helping with that. Let's see. What to know before you try EMDR. It's considered to be very safe with many fewer side effects than prescription medications. That said, there are some side effects that you may experience. A heightened awareness of thinking, which does not end immediately when the session does, which sort of makes sense. It's like I said, it sounds very intense. This can cause lightheadedness. It can also cause vivid, realistic dreams. And again, I would encourage the use of essential oils to help with that as well. Rose essential oil is amazing for, helping with nightmares, bad dreams. And then there's just other calming oils that would be helpful. It often takes several sessions to treat PTSD. So this does not work overnight. So if you're looking for a quick fix, this is not it. But I don't think there really is a quick fix for PTSD, right? And so I would love to know if you have heard of either of these treatments. And I do apologize, I don't know what, I only had a few minutes for this paper to go lost. I will put the actual definitions in the comments later. But EFT and EMDR, I think they are amazing tools, and I would encourage you to just do some research, see what you think. And if it's not for anything you need, there may be someone you know that could benefit. And also, I encourage you to go to hopeessential.com, to my website. I have a lot of tips on holistic, practitioners and natural solutions, blogs, and all sorts of good information. And sign up for my newsletter. So I appreciate you joining me tonight, and I hope this was some good information. Let me know if you had any aha moments. And until next time, choose you, choose natural, choose now.